1, 2, 3.
Hello there guys and welcome back to DR Damandis channel.
Smash the subscribe button.
If you're new.
No, we messed up.
You have to say if you're new.
Yeah, I know. We messed up there. You know the DR Damandis, I said YouTube, so
That's why I said you guys should decide if you want to
channel
put it or
no,
not.
No YouTube, just channel. We got this. Come on, bro.
I know you got it. That's why I trust you.
Wow. Thank you for the sarcasm.
I am serious.
Ouch.
This was not sarcasm.
Already with no bandage for this.
I am serious, guys. I trust you. That's why I am giving you that to do.
No, you can't trust this channel.
No, this one is presidential.
we don't trust dictators.
I am not a dictator. Okay,
After
please.
being in China for 5 long years, she has learned long footsteps of President Xi.
Okay.
That's what man like that. Atom, show your face.
Hello there guys and welcome back to DR Damandis channel.
If you are new, smash the subscribe button.
And don't forget to turn on your notification bell so that you'll be alerted whenever a new video is posted. In today's video, we are going to talk about our internship experiences in Namfang Hospital.
An internship consists of 52 weeks, and each department is divided into internal medicine and surgery. So our internship journey started from internal medicine and ended in surgery.
During our internship, these are the departments we went through: gastroenterology, Xiahuaneke, hematology, Suyeke. We have endocrinology, that's Nefenike, nephrology, Seineke, cardiology, Sineke, respiratory, Husineke, infection and diseases, Garaneke, ENT, Arbihoke. We have obstetrics and gynecology, Fuchanke, dermatology, Pifuke, imaging, Yinxianke, neurology, Sentineke, urology, Minyawaike, pediatrics, Arke, neonatal department, Sinsen Arneke, thoracic surgery, Sionwaike, emergency department, Tizenke, general surgery, Putongwaike, neurosurgery, Sentinwaike, trauma and orthopedics, that's Chuanguke, and anesthesiology, Matsuike.
In Chinese, anything that ends in Neike is internal medicine, and anything that ends in Waike is surgery department. So yeah, there was a lot of departments, bro. There was a lot of departments.
A lot of departments and more or less experience in, depending on the department we went through. So today we are just going to discuss individual experience in each department and and see which feelings we had, especially what we learned in each department. So my best friend here, BRUZ, is going to start by maybe choosing one of his best department or department he enjoyed most in NAICA.
I would say, for me, in internal medicine department, I have I learned a lot, to be honest, from different teachers, and it was just the starting. We just started. My first problem was I didn't know how to use the system, because you entry all the patient's details, what happened to them and everything. It was written in Chinese and there was no one to teach us like this is how you maneuver through the system. But thankfully, my first department was respiratory department, and there was a guy. He was doing his PG. He was in his final year. He was doing his PG, and then I remember my classmate Anais asked him to explain to us this. And because my Chinese was poor, so I did not give much thought about like how to learn and stuff. I was just playing around, and I was not much interested since everything was spoken in Chinese. So my interest was really vague and stuff. She went and asked. Later, she came and explained to all of us, like to me, how to maneuver through the system. Things started getting easier as each department passed by. My first department was respiratory, so in that department everything was new. So it was like a new experience. I did not know what to expect or to wear. I did not even know that I had to wear gloves when you enter somewhere where they use blood and stuff. And for me, my hands are big, compared to average people. So they usually keep glove size of 7.5. I require 8, and therefore the gloves I could not wear the gloves at all. It would tear, or I would be too slow in wearing the gloves. So I would not wear at all. I would feel fed up and stuff. But as it went through each department, you have to do a certain number of procedures. You can't say no to it, and they will if you have confidence, they will let you do it. My favorite internal medicine department was hematology. The reason is, my teacher, he couldn't speak English, but he tried his best to teach me. He gave me PPTs to learn. He told me to be confident. He gave me a lot of motivation when I felt like I didn't want to come to the hospital at all. My procedure there was lumbar puncture and bone marrow aspiration. He told me the second day, first day I went, everything he taught me, these are the department things, this is where we do this, we just go and see the patients and stuff. Second day we go, he says, okay, these are your procedures, lumbar puncture and bone marrow aspiration. So this teacher will take you and you can go and do it. So I have no experience, no clinical experience about all this stuff. He takes me, he gives me another doctor who's younger to him, and then he assigns him to me. We go to the bone aspiration place where they do all this stuff, and they asked me to wear the gloves. Do you know how to do? I said no, and then they said, okay, I'll show you once. They just showed me once. Everything was so fast because I needed time to learn, and I'm not that good of a student, But I try to learn.
I've seen the video almost like 40-50 times before
coming to the department because I was so nervous. It's my first time, and it's like we're doing on a real patient and stuff. And then he says, okay, you can do it. And then he just moves aside. It was not like even like touching you, holding your hand and you have to touch here, this place. He just said, go and do it. My hand was vibrating so bad. The nervousness was, everybody could see how nervous I was. But they were so nice to me, like it's still after all that, they would try their best to speak the English, and then they would tell me, don't worry, it's going to be alright, I'm here, you won't make mistakes. And thankfully, and due to God's grace and their nice, comforting words, I was able to learn it within the same day. And I was doing good also. I was able to do almost like 25
bone marrow aspirations before completing the department.
I was able to complete a lumbar puncture also. I think I was really happy because they were really patient to me,
Yeah.
Most other departments, what I felt was I did not know Chinese, proper Chinese, so I could not speak nor understand. The other thing was for me that they tried to teach, but their patience would go away really fast.
Oh. Yeah, so as you can hear, there's a lot of experience in NACO. For me, it was not much different, but for me, I'm not going to talk about all the NACO. For me, during my clinical rotation, my first department was CNACO, that's cardiology. And when you start, first time studying internship, I was like my friend said, was so nervous, you don't know how it's going to be and stuff. I even, after, because there's a morning meeting in the departments before starting before going rounds in the hospital, there's always meeting. So after that meeting, I personally went to my supervisor and asked him, like, can I talk to you? Like some 5 minutes or 2 minutes meeting. He was like, sure. I was like, wow, that's because I thought he's gonna tell me, oh, I'm busy, come next time. So that we had like 5 or 2 minutes meeting, and we told him, see, it's our first time, so if there's something we have to pay attention to, just let us know what time we should be here, if we have to leave early and all this stuff. So he make everything, like all these questions clear for us, and yeah, so from then I start my rotation, and for me, every department, for me, like, I mostly like observing, but if a department is really like right now, if you ask me which one was your best department in this rotation, I will say the departments that I put my hands on in, let's say, practicing or practicing something, like BRUZ here, bone marrow punctures. Those are the things that you have to put your hands on. You have to go and experience real life stuff. This one has no books more. So in cardiology, it was the first department I did my ECG to a patient. So I was also nervous because I was like, I even quickly checked the internet to see what are the right positions, because it was the first time I see an ECG in the hospital, and I was checking the levels, everything. So so cardiology department cardiology department is one of the department that kind of motivates me to start liking my internship. I was even start because after our let's say day, like we finish our internship around let's say 5 days. Actually depends on your teacher, but I always used to go in the evenings to see, because I start liking it, I start almost loving it. I start going there. The teacher used to ask me, but you have to be home now. I said, no, I want to see more what's going on. So I start liking it. I start going in. So those departments like cardiology, we also have hematology, because the teacher gave me the chance to do a bone marrow puncture, and also to do a physical exam on a person who have a large spleen. It was my first time, and it was really good. And also we have nephrology. Yes, nephrology was, for me, it's not only about going there, because the teachers, because I'm someone because you meet some teachers that they are not willing to teach, but me, I have my ways of kind of provoking them, or kind of how can I say, maybe you can use attracting them to kind of pay attention, because I'm your student. You don't have to ignore me, because what I do, I just go there. I'll just let's assume this is my teacher. He will start explaining the cases. If I'll sit beside the teacher. I'll just be looking at the teacher like this. Okay, like looking at it face to face, shaking my head, and for the teacher to notice that, I want to be part of this discussion, and the teacher will start asking me, oh, can you speak Chinese and all this stuff? And I'll be like, yeah, a little bit, yes. Start asking questions and stuff, because if the teacher sees that during the discussion you are behind, you are not even around, so some of them will think you are not even interested in learning. So just find your ways to let them know that you really want to learn. So nephrology and also neurology. The neurology is like, I don't have words. Neurology, it was
awesome.
Oh my god, it was, oh my god, that moment when you taste that favorite food of yours and you're like, oh my god. Because I was the teacher was so good in explaining, the way she even trained her students, because she was a lady, and she trained her students, she asks questions, she teaches, and I love that, you know. So when I saw her doing that, I was like, wow, I should be, you know, doing that in maybe 10 years time or something like that. So neurology, it was excellent.
And neurology was that good?
Yeah, neurology, I was in how do you call it, cerebrovascular diseases group. Yeah, that group was, you know, amazing, you know. And yeah, I think that's almost everything in NACO for me.
For me, I would like to add one more
Yeah.
thing. In internal medicine department, my best department was hemato. But the thing is, I had other teachers also from other departments teaching me really well. At first, my problem was I would never, as you said, you have to stay to show your interest.
Yeah,
you know? I would never show my interest. I would be like, oh, the teacher doesn't want to teach me. Oh, he's busy. So I would come at just before 8 o'clock, 10 minutes before, come and sit down, go along with the people with the rounds. The rounds finishes, let's say 9 o'clock, 9:30. I jump back. I'm going back. I have nothing to do, but I didn't want to stay there because I felt like I was so uneasy because I didn't get to teach anything. I used to think, oh, because we're international people, or because maybe I don't know Chinese, that's why they don't want to teach me. I used to put all these thoughts in my head. Then my classmates, and I still remember Atom telling me, bro, just show your interest and sit there. Just talk to them, they will teach you. But at first I was being sarcastic at the same time, telling him, thinking in my mind, oh, it's just because Atom knows Chinese, you know, so that's why he's saying all these words. But I remember during the endocrinology department, I took your words to heart. I remember staying Saturday, we had to come, and Saturday afternoon everybody leaves. I stayed there till 6 o'clock. There was no teachers inside, I was just looking around, checking all the results. And I met a teacher. She spoke fluent English, bro.
Wow.
It was my last day on that department. I was like, and the teacher was like, I haven't never seen you. I said, this is the only day I've stood here till this long. And we spoke for 4 hours about different things, country, diseases. She taught me a lot about kidney, how medicines can affect them and stuff. I was thinking, at that time, my mind clicked, I should stay. Next time onwards, it doesn't matter if the teacher doesn't teach you at first. Like how you said, provoke them or show them that you want to, you are willing to study. It doesn't matter how much physical effort needs to be taken place, you know. But yeah, it was, when you said that, I really felt that motivation, you know, you gotta go. And it was so, when you find teachers like that to teach you, best thing is, you feel so satisfied. You come back, you want to learn about that department, you go back again, next day with a happy face, you show up, you want to learn more, you start asking questions, you start thinking about that department more, you know, in an overall way. And like a doctor, to be honest, I really do felt, because, and the hands-on thing is that when you see, the thing is, we're international students, the patient comes, and then he just sees you and you're doing your stuff, alright? You might be nervous, but the patient does not know. I still remember I did my bone marrow aspiration. At first it was all so messy, bleeding was there. Little I got better. In the end days, there was no pain. I did fast, my anesthesia was good and everything. The patient comes and says, yes, that honest way of saying that, I felt so good. I was like in my mind, man, I'm an angel right now. I got a halo on my head.
Yeah, that thank you that comes from the patient mouth is really, you know, making you like, is really motivating you to whatever you are doing good, keep doing it. You know, don't stop. That session is very important. You know, and also of course you will also meet some patients that they already know that you are an intern, especially a foreigner, so they will be asking. In my case, there was a patient that I had to do how do you call it? I had to do a physical examination in nephrology. The patient, because you know we were in the elevator, right? You know that moment, because in the afternoon we start going to hospital from 2:30, depends on actually which in your group or your supervisor advice. And we were in the elevator and the patient looked at me, the person look at me like this and start, putting those masks and stuff. I'm like, okay, no problem, no matter. And we were in the hospital going to that nephrology department, and the patient start putting masks, start going
Sideways,
yeah.
I get it.
I was like, okay, no problem. We went, boom, and after that, after that, my teacher said, oh, there's a new patient. You can just do a physical examination, and I'll be writing the report, getting ready. I mean, getting ready for her, for her to be admitted. I said, okay. And when I went, and she was the first patient, I mean, she was the same person who was, I was like,
why me?
Well, her first was no, because the first that she put in the elevator was like, and when she showed me coming to when she showed me as the person who's coming to do a physical examination, she was like, and she asked, she was standing near the nurse station, she was like, is here, doctor? I was like, yeah. And still after that, the patient was, I don't know, she started talking Guangdonghua with the nurse and stuff, and still she still asks for another colleague of mine to come and do a physical examination on her. So yeah, these are the things that you will be seeing, especially when you are in a hospital where people still don't after all, patients can make their choices, right? Patient you can tell the patient, okay, this is my treatment plan for you, this is what you have to do, and still the patient can say no, and there's nothing to do about it. So yeah, in NAICA, so these are almost with all the experience we had there.
Some patients are open-minded, some are, you can't say anything.
Yeah, you can't say anything. You just have to respect their decision.
Yeah, respect the decision.
And move on. Yeah.
True.
After all, we all want the best for them.
Yes.
Yeah.
True. But you bring that mentality in you, bruh. Tipped me a lot.
Yes. So the I can say the part where I said about provoking the teachers. Actually, that was my plan since, months before we started in internship, because I know there were some teachers that were will not be willing to help or teach, and stuff. So yeah, that was. How
was your surgery department? They were all good, or they were all bad?
Surgery surgery department were better than internal medicine departments. Because surgery is surgery. Surgery
is surgery.
Yeah, surgery is surgery, but in surgery, like he said, like when a patient give you that thank you or that see how you feel, right? That's the same way I feel when I put the scraps on. When I put the scraps on, I'm like, bring them, But still, that's just a feeling. Doesn't mean that I know everything, but that's just a feeling. When you put the scraps on, when the teacher allows you to assist in surgeries, that's the oof. I like that when the teacher, there are some teachers that will just say, oh, come in, or just scrub in, and there's other teachers that will say that they will ask you, do you want to come in? Other teacher will say scrub in. Other teacher will say, have you assisted in any surgery? Depends on the teachers. But for me, most of the teachers will just ask me to scrub it. That moment is, it's like I'm 100% sure I'm going to learn something, like no doubt. And especially when the teacher is asking me to close. The first time they asked me to close, like let's say a wound after a surgery, it was in ENT. Yeah, ENT. The teacher was good. Like I just there are some people that
you just see them, you just feel like safe. You just feel like happy
because you are coming to learn a lot. He didn't even ask me like, oh, have you closed before? Have you do you know how to close? But when there are some professors, they'll start doing surgeries, they'll just say close. They'll not like, after they'll say close, they'll just get out of the operating room because you should be knowing what you should do next. But thanks, I wasn't alone. I was with another person, and yeah, that was my first time I closed up.
The suturing.
Yeah, the suturing, and it was an experience that wow. Because actually, I want to
become one of them. I mean, I want to become a surgeon, and
when I come through these experiences, I'm like, let's keep moving, Yeah. And yeah, many departments went to ENT. I went to ENT. I mostly enjoy ENT, and also I enjoy in general surgery. I mean, general surgery, and most of the surgery I attended, it was laparoscopy, where you have to insert these machines in the body, and in the body and start operating. It's not mostly about cutting white open, but for that I only assisted in one surgery. Yeah, I was expecting to do more, but yeah, that was also good. After all, one is better than doing nothing, right? And yeah, general surgery, and also orthopedics. Almost all the surgical department I went through.
For me, I would say it's like internship for each person is different. Mm-hmm. Everybody has their own path to move forward, For me, personally, I think out of all the students who did internship in our batch, I'm the more late bloomer in getting into the surgery department, because I started late. Everybody went on the first week to the surgery department and started scrubbing and stuff. I had to wait till gynecology department to scrub. Of course I would go into the surgery building and then see the surgeries and stuff, but I had to wait till gynecology. And fortunately, I was with a teacher who spoke English, and I did not have many. We had only one Chinese intern in our group, so it was that teacher, me, and a Chinese intern. So she could focus on us and she was in the outpatient department also. So every patient comes, and there were not that many patients also. So every patient comes, we would hear her. She would explain just there and there. This is what this patient said, or she has mucus coming out, or she does not have menstruation, or her menstruation is abnormal. She has 40 days of menstruation, 35 days. So I would get all the info just right away, and then think. And she would say, okay, these are the symptoms of this patient. Tell me what's wrong with her. What test are we supposed to do? So it really felt like we are giving a second opinion as a doctor, It was good. We went for scrubbing almost 2 weeks. In 2 weeks,
I did almost like 12, 13 surgeries in
2 weeks. That was like really awesome. Seriously, no other department I've done that many surgeries in 2 weeks. Gynecology, for me, gynecology was the most awesome, I think, for me personally. My favorite department is urology, because the sir, as you know, the sir was like really nice to me, and he was explaining to me all the procedures and stuff, and he would let me do, he would let me do the procedures and stuff, and I would stick with him.
Yeah.
For both drinking purposes and working as an intern, Even when I shifted to other departments, he would always call me, if you're free, come join for the surgery, I will teach you. And it was laparoscopic mainly, so I thought I won't get to do stuff. Then the new department came, they shifted everything to the new building. We have for those who don't know, a new surgery building has been constructed, and everything has been shifted to the new surgery building. So when they started there, the equipments were different. He started showing me how to do stuff, and I got even to break stones. Till I was there in the department, the stones were always the same, the color and type and stuff. When we changed to the new department, I saw a new patient. She had a different type of stones. Her stones were really big, and we had a bag of those stones. We collected a bag of those stones. It was really nice, fun. It's exciting, And the sound
of the breaking of stones is like a machine gun.
Yeah, so that was interesting. Dermatology was nice. It was, for me, my teacher was the teacher who taught us dermatology. The lady who speaks English.
Oh,
yeah. She was the one who was for me dermatology.
Yeah.
She was really nice. She took because she was the one my teacher, so she would teach me. She would tell me explain everything, what's wrong and stuff, and say the exact medical name of the disease. You know, always you gotta search, or they say only fibulae or something like that. She would say it's pemphigus, or it is sebaceous something, or like that. Like it keeps on going. Then I had medical imaging. Medical imaging, I would just go and stand. That's it. I didn't learn much in medical imaging, to be honest. We just had to go for rounds and then we would just be back. There's no one to teach us about what to look in the images and stuff. It was all self-taught and internet and books. Pediatrics was hectic because because in pediatrics you have to the patients are always kids. They start yelling at, and you don't see what the symptoms are at them because the kids cannot speak themselves. It's the mothers who are telling about the kids. This is their problems and stuff. That's why I couldn't understand much, and my teacher did not speak much English. So pediatrics was hectic for me, and it was for 6 weeks. So yeah, it was a pretty long time to be staying in pediatrics. I wished I had other departments that were longer than as long as pediatrics, then give pediatrics that many weeks. And last, I will talk about emergency. Emergency is not like how you see in movies, it's not that bad. It could be, but like sometimes the people who come in the emergency trauma and stuff, for those cases, yeah, it is pretty bad. But when you're in emergency department, usually it comes for like small cuts or bruises, or they broke their bones and immediate, because they don't know, or they come for, they do not know which department they have to go to. So they come as a pre-checkup to the emergency department so that they'll be assigned to the right department. But yeah, otherwise the whole surgery department of our hospital was really, really great. A lot of new equipments. To be honest, I have been awed at the new surgery building. Everything is mechanized. You see how the dresses are coming out, the cards swiping off. The surgery building is bigger. I mean, each surgery room is bigger. The machines are nice. It's a lot to learn,
Yeah, really.
It was really wonderful. Most peculiar part about the surgery department was surgery for neurosurgery. I'm serious. Literally, the doctor this is all he does. It felt like, what do you say? In Kung Fu Panda, the grasshopper guy? He has a hands like that. But yeah, he would just use his hands and stuff like that. But yeah, otherwise, the whole surgery department was awesome. And personally, I think my internship felt great. Though in the first half, it felt like a little bit lacking, but I knew how to come up, to bring myself up for those lackings, So yeah.
Yeah, exactly, guys. So this is the end for our, experiences in Southern Medical University in Downtown Hospital during our internship and all the stuff we went through. That's all, guys. If you have any question or you have been through a different experience from us here in China, drop it down below the comment and we will catch up and follow your questions. And don't forget to subscribe, like,
comment and share. Please watch the video till the end. Guys.
And Dr. Damandi, love you guys a lot.
See you guys next time.
Bye.
Hope you have a fun weekend.
Hello guys, and welcome back to Dr. Damandi's channel.
If you are new, smash the subscribe button
and don't forget to turn on your notification so that you'll be alerted whenever a new video is posted.
Jesus, Daniel.
No, I'm not, or yes, I'm free. Those are the only two ends. It was so, bro, I was like, I just woke up from my sleep, right? I was like, did I wake up in a different world? Am I in a different portal right now?
So it goes like, we start. No, I don't want to say hello the guys. I want you to say.
I want you. Yeah, I get you. We will say hello, the guys. Welcome back to. Then what?
My YouTube channel. I'll be standing behind you. Okay, you can say that.
Welcome back to.
Yeah.
The Mondays. It's not our YouTube
Welcome
channel.
back to this channel.
Okay, yeah, this one is better.
What?
Welcome back to this channel. I will put
this.
the name of the channel.
We can just say it.
But you said just said that it doesn't ring.
Doesn't really work.
It doesn't ring. Welcome back to Dr. Damandi's channel. It's a little bit long.
Can we rewind whether I said it doesn't ring? Just like
I don't know how to rewind.
We knew that.
Okay. Can we do? No.
Hello, the guys. Welcome back to. You can start.
No, you say both at the same time. Then you somebody will say, if you are new, smash the subscribe button, and you say, don't forget to turn on your notification bell so that you will be alerted when a new video is posted. Adam, can you? Adam, can you say that? Why is it difficult?
I will try.
Okay, let's rehearse. Let's see. So 1, 2, 3.
Hello, the guys, and welcome back to
Dr. Damandi's channel.
Smash
If you are new,
smash the like button.
and don't forget to subscribe so that you'll be alerted when.
Stop laughing. You see, this is what I don't like.
No. You said it well before. Then when I say we try, you are saying subscribe. At one moment.
I went for first. It was not like smash the like button.
Smash the subscribe button.
Oh, we are smashing the subscribe button.
Yeah.
Okay. Smash the subscribe button.
And don't forget to turn on your notification bell so that you will be alerted when a new video is posted.
You already know that.
Okay.
Don't forget to turn on the notification bell.
So that you will be alerted when a new video is posted. So
where does the light come from? The light.
that's when we finish.
When we finish. So there's no like at all in the beginning.
If
I'm just asking.
no, if you want to put what
We don't need
moment
to
you.
put. You don't need to put. You can the end. Then in the end.
Okay. So you know,
Hello,
right?
guys, and welcome back to. No.
No.
And then subscribe. What you start and
Welcome back to.
Dr. Damandi's YouTube channel.
If you're new, right? If you're new,
Smash the subscribe button.
so that you'll be alerted when.
No. And don't forget to turn on your notification bell so that you will be alerted when a new
Smash
video.
the subscribe button and don't
Don't forget
forget
to turn on the notification bell or your
so that you will
notification
be alerted
when a new video is posted.
So that you'll be alerted when a new video. I'll say this. And don't forget to turn on the notification bell so that you will be alerted when a new video is posted.
Yeah.
Okay.
Okay, can we-
Wait. I just need to bring it in my brain. Don't forget to turn on the notification bell. Don't forget. That's good.
Okay. Are you ready?
Yes.
Like to rehearse?
Yeah, rehearse.
Yeah.
Obviously. Very good. Ha!
Okay.
In today's video, we are going to talk about our.
Again.
Okay.
In today's video, we are going to talk about our. Let's go.
Can you give me some water, please?
Sure.
Take this one. I don't know why the man gave it to me. You can also be recording how he's drinking water in the video.
Okay.
In today's video, are you recording?
We are going to talk about our
In today's
internship.
video, we are going to talk about our internship experiences in Nampang Hospital.
Okay.
Again. Yeah, seriously.
Now, in today's video, we are going to talk about our
Yes!
about our internship. Okay, let's go.
It is
And turn on the notification bell. And
No,
Oh, you
don't
already said the
forget
intro.
to like, comment, subscribe, and share. And
why
share,
should we
you
to share?
see.
Just-
Don't
Okay, you say
forget.
subscribe and like, comment, and share.
Don't forget to.
Subscribe,
Like
share.
and comment.
No, just one to like. One person will say 2, another person say 2.
Okay, don't forget to. Who is starting? Who is beginning?
He is ending because he ended the video.
So don't.
Yeah. What did you say? You said, guys.
What?
And
I
don't
hope to see you next. No, I hope.
I hope you guys. I hope you guys.
Hope to see the next video. Whatever I say is the next video, and the next video is the last sentence.
Okay.
To see you the next video.
Okay. Okay.
And don't forget. Then I will start with. Don't forget to
Subscribe,
like,
comment, and share.
so that you'll be.
What is the so that you will be? Don't forget to, when you finish saying those 4 things, you can say, I will love you guys. And please watch the video till the end. You tell them that. And please watch the video till the end. We love you guys. Then you say bye bye. Then I end. Don't clap. Wait for, I don't know, a few seconds before you clap at.
Gotcha.
Okay?
I'm
Okay.
I shall yell.
Don't forget to subscribe, like,
Comment and share.
yeah.
So what can I do?
Okay. Don't, when you, the two you say, then you say all together,
Please
watch till the end.
Please watch till the end.
And we love you guys.
Love you guys.
Yes.
We say
Bye bye.
Damandi
Loves you.
guys. We just say Damandi love you guys.
Then
those people
bye
who watch
bye.
this video till the end, the money sponsors 500 US per person.
Yeah, that's a motivation. That's a motivation.
Okay, 0.5 yens per person. Like that. Oh, that felt shitty, huh? So when I said 500 yens, I went,
No. Okay.
Don't
So
forget to subscribe, like.
comment and share.
it comes as it comes, because when I on the video he will say another thing. So you just try to catch up what he says and
comment
say what
and share. He'll say subscribe and like.
Don't
I'm sure.
forget to subscribe, like,
Comment and share.
and what we have to say.
Guys, please watch the video till the end.
Guys, please watch it. If you forget,
You
I'll
say,
say.
you say. You know, just repeat that.
Sure.
Yeah, then you say we love you. Bye bye.
Bye bye.
Yes.
Mwah. Go ahead. Sorry.
Don't forget to subscribe, like,
Comment and share. We would like you to watch the video till the end.
yeah, till the end. Damandi, love you a lot.
Very much.
Yes.
See you next time.
Bye.
Hope to see you next time.
Don't forget to subscribe, like,
Comment and share. Please don't forget to watch the video till the end.
till the end, guys. Damandi, love you guys so much. Why are you laughing? Don't forget to subscribe, like,
Comment and share. Please watch the video till the end.
till the end. Damandi, love you
Loves
guys
you.
so much. Bye.
See you next time.
I beg you.
No, that's not the problem. That's not the problem. This is the end.
No, they are bloopers at the end. Let them watch till the end.
Okay, I was like, we already in the end. We are asking.
No, you know, most of the people, they just watch the beginning, or they just
But you
roll it down
already
to the
write, right? I think in the last video, I think you wrote that stuff, right?
Yeah,
People-
I pinned
So
it
I
in
was
the
like,
comments.
so Yeah, anyways, okay, sure, we'll say that. No worries.
Okay. Like if you want them to comment, you have to tell it before saying like, comment, subscribe, and then
Go ahead.
like you tell them if they had a different experience. For those who did your internship, let them comment. You comment
I'm saying it after.
before.
You just say it
Before.
first.
Before.
This is what you say now.
Okay.